I am Gabby Albert. I'm the Executive Director for 4Kira4Moms, and we are so excited to have you guys here this morning with us, with U.S. Representative Underwood and Gomez, along with the Dads Caucus and the Congressional Black Maternal Health Caucus, and our founder, Charles Johnson. We decided that this was an important conversation to have as we all rally for this human rights issue, not women's health, a human rights issue. And we want to really talk today about how do we engage the front line, which is the fathers, in the fight. So we will start with opening remarks by Erica Johnson Kramer, from Walmart. And then we'll get into a breakfast with Charles Johnson, Representative Underwood, Representative Gomez. So thank you all for joining us this morning.
Good morning, everyone. Thank you so much, Gabby, for that introduction. And I too want to extend my welcome. I'm Erica Johnson Kramer, Senior Director of Federal Government Affairs for Walmart. And we are just really delighted to be able to support this conversation. On behalf of our 1.6 million associates around the country, we recognize this is an important and critical and valuable conversation, and so we're pleased to be able to support it. Walmart has long since had a commitment to offering affordable and accessible health and wellness services. As far back as 1978, Walmart opened its first pharmacy. Don't worry, I'm going to get to why I'm talking about pharmacies. We opened our first pharmacy in 1978, and today we have 4,500 pharmacies around the country, 4,000 of which are in communities that are affected by a shortage of medical professionals. We have more than 15,000 pharmacists. Nearly half of them have been with Walmart for more than 10 years. And some of them, many of them, 15% in fact, have been with Walmart for more than 20 years. So these are dedicated professionals who have been in their communities. They know the communities, they know the people in the communities, the people who are coming in those stores, in their pharmacies day to day. They have relationships with them. They're building trusted relationships with them. And I share those statistics about pharmacies not because we think that the pharmacist is the first stop, the only stop, the alternative. However, I share those statistics because we think that pharmacists have a really important role, a valuable role to play, a helpful role to play in the pregnancy journey for moms to be, not instead of, but in addition to their physicians. And if you consider that 90% of the U.S. population lives within 5 miles of a Walmart, that's a lot of access. It's a lot of great access. And we hope that we continue to have a role to play to help those moms to be, and the dads to be, along that pregnancy journey, because that's the conversation that we're here to talk about today. Walmart offers a number of benefits, maternal benefits and paternal benefits to our associates, from doula benefits. We think that's a valuable service for our associates to be able to have at their access. And then also paid leave for our full-time hourly and salaried associates, not just salaried, hourly and salaried associates have that paid leave benefit. So with that, I don't want to take a lot of time from this conversation because I too am eager to hear from our speakers today. And with that, I want to thank Congresswoman Underwood, Congressman Gomez for the important work that you all are doing through the Black Maternal Health Caucus, through the Congressional Dads Caucus, and not just conversations. You're not just having conversations. This is going to be an important one, but I want to thank you for having these important conversations and taking action. Very much appreciated. And with that, I want to turn it over to Charles Johnson. It's been a pleasure to meet you today, and I look forward to hearing from you. Thank you.
All right, good morning, everybody. Oh man, look, I'm over here cheesing like a pizza because I'm so excited. I really am going to be brief, but I really just want to start by extending immense gratitude to all of you all who have got up bright and early to be here with us. I saw some of you all, I'm not going to say where I saw y'all last night, but it was well past my bedtime, but y'all wear it well. So thank you for being here. Thank you to Walmart. Thank you, Erica, for your work and your partnership. Special thank you to my friends, my dear friends, Congresswoman Underwood, Congressman Gomez, and thank you for your teams for helping us put this together under very short notice. I have so many partners and friends that are here. The list is too long and it'll take me all day, but so a big thank you and warm hugs to all of you for being here. My heart is full, and I have to say before I go any further, thank you to Gabby Albert, who is our executive director, who without this, she is a force of nature. Y'all, we're so lucky to have her. Thank you for putting this together. And she keeps me laser focused and moving forward. So with that being said, you know, I'm gonna move out of the way because I want to get y'all, congratulations, y'all got tricked. We lured you here with eggs and croissants and coffee, but we are here to work. We are here to work. Because if you are in this room, you believe, like all of us do, that mothers and babies in this country deserve better. And that this issue around saving mothers and empowering families with the tools and resources they need to not only survive, but to thrive before, during, and after the pregnancy journey is not a women's health issue, it is not a liberal issue, it is not a conservative issue. It is a human rights issue, and it should be a fundamental human right for every single mother or birthing person in our country to give birth to a healthy child and raise that child. With that being said, there is a tremendous amount of focus on mothers and babies and their well-being, as there should be. But what we have seen historically in this country is that the third part of that trilogy, which is the father or non-birthing parent, is far too often left out. So today we are here to talk about what we are doing from a community standpoint, from a legislative standpoint, to not only shore up and protect mothers and babies, but to make sure that fathers have the resources they need to be more informed, more empowered advocates and support systems. So I'm so grateful. With that being said, I want to introduce my dear friend, Representative Lauren Underwood. And I have to say this, the only bone I have to pick with Representative Underwood is that she is not my personal congresswoman. I got a chance to spend some time in Juliet 2 weeks ago, which is her backyard and her stomping ground. And I'm about ready to move because I'm not going to tell you, I live in Vinings, Georgia, and we're not going to talk about who my rep is. But with that being said, but I have a neighbor back there, he knows who it is. But with that being said, you know, one thing I have to say about Representative Underwood, I could say a lot, but one of the things as I was just thinking about, and my heart was so full this morning, is just trust. And the fact that this work towards building the Momnibus has been a true partnership. And I don't know if anybody, until we get this finished and when this thing is dissected, will truly understand what type of leadership it takes to galvanize the stakeholders, the grassroots people, the people with lived experience, the midwives, the doulas, the corporate interests, and bring them together under one tent to put together a comprehensive set of 13 different pieces of legislation and then steer that ship steadfast through all of the hurdles. And so I'm grateful, and when I say trust, because I can trust without a shadow of a doubt that she will not compromise and will not waver to the things that are important to us, the people who have been impacted by the maternal mortality crisis. So with that, I want to say thank you, and I want to welcome my dear friend, Representative Lauren Underwood.
Good morning, everyone. Welcome to the Capitol. We're really excited to have you here today. I'm Congresswoman Lauren Underwood, and I'm honored to represent the 14th District of Illinois, and I'm the co-founder and co-chair of the Black Maternal Health Caucus. I want to thank Charles and Gabby for inviting me to be here for the tremendous work that you do with 4Kira4Moms. And as you said, the partnership and the trust.
We've been able to develop not only a great work product, but something that's saving lives across the country, and that I know we will get this legislation signed into law. I also want to thank my friend and colleague, Congressman Jimmy Gomez, the visionary leader behind the Congressional Dads Caucus. We're also joined by Congressman Seth Magaziner, who's a very active member of the Congressional Dads Caucus. And you know, the emergence of this group has really just united so many different parts of our House Democratic Caucus to focus on this issue from a vantage point that we hadn't necessarily heard from in the halls of Congress. And I'm so grateful for your leadership and partnership here today. And thank all of you for being here to have this discussion. You know, we have really taken the Black maternal health crisis from just a very small kind of footnote discussion here in the halls of Congress to a movement that is unstoppable. And so folks may think that this is an issue that impacts just some families in some places and that they can just ignore us, but they are quickly learning
that it's easier to just get on board and stand with us and support us to get this money and to drive the change that we need to save lives. 5 years ago, Congresswoman Alma Adams and I launched the Black Maternal Health Caucus. And with 53 founding members, we created the caucus to organize around goals of simply elevating the Black maternal health crisis here on Capitol Hill and advancing policy solutions that would end the disparities that we see related to maternal mortality. Since then, we've grown into one of the largest bipartisan caucuses on Capitol Hill with over 110 members across the House and the Senate. Thank you. And we are so proud of how far we've come, and we remain focused on our goal, which is to advance the only comprehensive solution to ending our nation's maternal health crisis, which is a bill called the Momnibus. Now, you've already heard from Charles. The Momnibus is a comprehensive package, 13 bills that are designed to address every clinical and non-clinical factor leading to preventable maternal death in this country. Now, we first introduced this bill in March of 2020 with then Senator Kamala Harris, and now I am proud to lead the legislation here in the House with Senator Cory Booker. And we're doing the work, and we are not going to stop until the entire Momnibus is enacted. The legislation includes investments to grow and diversify what we call the perinatal workforce. So that's more doctors, more OBs, more midwives, more nurse midwives, more doulas, more lactation consultants. We're improving data collection, which has really been a thorny problem throughout the states. We're funding community-based organizations. We're expanding access to social determinants like housing and nutrition, environmental, healthy environments during and after pregnancy. And then we're supporting moms with mental health conditions and substance use disorders, which has risen to become the #1 killer of moms in the United States, including for Black moms when you combine suicide and overdose. The Momnibus is not a study bill. We're not just further investigating. This is a bill designed to solve, to end the crisis that we have in this country. And I'm so proud to say that our colleagues here on Capitol Hill are recognizing that. So when we reintroduced the Momnibus for this Congress, we did so with more than 200 original co-sponsors between the House and the Senate. And we've made incredible progress in moving the Momnibus through. We've passed the first Momnibus bill into law, the Protecting Moms Who Served Act. It's bipartisan legislation that invests in world-class maternity care for our veterans, our heroes. And since then, we passed this in 2021, and it's been working over at VA. So now we need to reauthorize this program. And the successor bill is called the Maternal Health for Veterans Act. I was honored to testify before the House Veterans Affairs Committee in support of that bill earlier this year. And the conversations about maternal health and the Momnibus aren't just happening here in the House. Just a few months ago, the Senate Help Committee held their first hearing this Congress on the maternal health crisis, where Chairman Bernie Sanders and the other senators literally said the words, "We must pass the Momnibus." So that's huge. That's not all. For the 5th year in a row, the Black Maternal Health Caucus has secured significant federal resources to address our maternal health crisis and save moms' lives. In the 2024 federal funding package that President Biden signed into law this past March, our caucus secured over $100 million. I want you to hear me say $100 million. $100 million. In funding for Momnibus priorities. These are new dollars that we fought for, and that's on top of the $100 million we secured last year. So we're talking about $200 million, and it's one of the only direct funding streams for community-based organizations, those small, hyper-local groups that were in the community, on the ground, in the neighborhood, doing the work while our moms were dying, and the federal government was nowhere to be found. So now we have a direct conduit to support those organizations, as well as now for the first time direct funding for our HBCUs and our minority-serving institutions to study maternal health disparities. And we've included significant resources. Another colleague, Congressman Josh Gottheimer, a member of the DAGS caucus, thank you for being here with us. We've secured significant investments for moms in rural communities. So now's the time to build on the momentum that we've seen and get the whole Momnibus passed through the House, passed through the Senate, and signed into law. We know how to end the maternal health crisis. The solutions are out there. The solutions are in the Momnibus. So thanks to advocacy from the folks in this room, we know that we can get this legislation across the finish line. I am so excited to continue our work together in these final few months. This is going to be a push, my friends, but we can do this. Thank you so much. To bring up the leader of the Congressional Dads Caucus, my friend and colleague, Congressman Jimmy Gomez, who represents a vibrant, beautiful community in sunny Los Angeles. Thank you for being here with us to present this breakfast discussion today. Congressman Gomez.
Let's give it up for Lauren Underwood for all her. First, let me just thank everyone for putting this together, also my team and Lauren's team and everyone, and then also the members of the Dads Caucus. This issue when it comes to maternal health, or even just health disparities, is something I've thought about for my entire life. I grew up without health insurance, and when I got sick with pneumonia, I went to the hospital for a week. And back then, if you didn't have health insurance, you had to put up collateral. And my family had to put up the house to say that they were gonna pay the bills. But you know, it got a little tight. They missed a few payments. We almost lost the house. In the end, they came through, my parents did. But no family should almost go bankrupt because you get sick. And at the same time, we know that the disparities that exist between people that have health insurance and don't, but even the ones that have health insurance are just extreme. And one of the things that I always thought about, and I'm glad you said it was about justice, because I tell people, it's like, if you're angry when somebody gets pulled over because of their color of their skin, you should be even just as angry if somebody's gonna die because of the color of their skin, right? And that's what's happening, is we have a situation where just the health outcomes for individuals from minority backgrounds is just more extreme. We know that if a black woman, this is where one of the statistics, I carried a bill or a piece of legislation when I was in the House, in the California legislature, that said black women were more likely to die of breast cancer than white women, even though the incidence of breast cancer is higher in white women, right? So it's like, when you start thinking about that, it's like, what's going on? And as you dig in, you realize that we have a health system. Doesn't matter if you have health care, or you go to the best institutions, you will be treated differently, your health outcomes will be worse often, and in the end, your family will be worse. So this is a personal issue for me. And I got involved first with the Mama's Caucus. I joined the Mama's Caucus when Rashida Tlaib started it, and it was because of those reasons. And I wanted to make sure that I did my part. But then I had a son, his name is Hodge, he's 2 years old. Toddler phase is a whole different phase, by the way. I had no idea. I have the bite and scars to prove it. And it was amazing, but you definitely see the differences in treatment. And we ended up going viral because I took my son to the floor and got a lot of praise for what women do every single day, what mothers do every single day, which is work and take care of their kids. And rightly or wrongly, we wanted to take advantage of that viral moment to create a movement of dads. So Josh Gottheimer, Seth Magaziner, as well as now 38 dads, actually 39 dads. Don Davis just yesterday reached out saying he's joining. So we're at 39 dads. And 3 of these dads are going to be going off to the Senate, Ruben Gallego, Andy Kim, and Adam Schiff. So we're going to have counterparts saying that this issue is crucial. And one of the issues that we endorsed was the Momnibus bill to deal with the maternal mortality crisis that we're having in this country. Because we know that it impacts every one of our districts, but dads need to step up and do more. We know that black women are 3 times more likely to die from pregnancy-related causes than their white counterparts. Black women are dying of eclampsia and preeclampsia at 5 times the rate of white women. And I've seen this personally. when I was in, and the risks of childbirth. My son, we named him Hodge. That's my wife's last name. I said, we don't risk giving birth, women do. So we decided to honor my wife with, by naming my son Hodge after her last name. When she gave birth, it was a little rougher than we expected. It took longer. She ended up having a C-section, but we thought we were out of the woods, right? We thought this was, we were gonna be okay. So we go home, and she starts looking at her pill bottles, like her prescriptions, and she couldn't really read the prescription label. So we're like, oh, that's not right. And we know that her blood pressure spiked during delivery, so we kept on measuring. And I have high blood pressure, so I used my monitor to make sure that her blood pressure was going down. It never went down. So we go in to the hospital that she gave birth at, and the waiting rooms were super long, the wait times. So I don't believe in using my title, but I called my friend and I asked him to use this title called Government Affairs to get us in. Because there's no way I'm going to let something happen to my wife just because there's a long waiting time. And what we discovered is something called postpartum preeclampsia. The fact that we know that is extremely dangerous, and 40% of post deaths of mothers is because of postpartum preeclampsia. So I'm curious. I start looking up that information, what's going on. There's no research, very little. There's no real funding. Most people don't know about it. So most people go home thinking that they're okay, and then the mother dies unexpectedly. But we know that it is very, very common. That's why it's important to support the Momnibus, to make sure that the people are looking out for those risks. And that's one of the things that we're going to keep fighting for the Momnibus Act, to make sure that funding is there, because it's often the community groups that know about it, that have been doing the education, that have been doing the outreach, that are telling people to watch out. So when it comes to maternal mortality and maternal health, we also know that dads can play a big role in that, because we're the ones that should be right there, making sure we have paid family leave, taking time off, making sure that we're there to assist, and we know the benefits. The child is healthier, the mother is healthier, you actually reduce postpartum depression, and the father actually reduces postpartum depression and is healthier. So the outcomes are just huge. And that's one of the things that we want to make sure that we're doing, is advocating. And then we started advocating something called, we sent a letter to Health and Human Services, something called PRAMS for Dads. It's Pregnancy Risk Assessment Monitoring System. So it's not only helping dads monitoring their own health, but also monitoring the health of their spouse or the mother of their child, to make sure that, one, you're having blurry vision, we got to do something about it. You're having, your wound from a C-section doesn't look right, we're going to have to do something about it. So this is a pilot program that we know that's going to have impacts. So this is what it's about. This is a crisis. We got to gather up. We got to get everybody involved, and that's what the Dads Caucus is about. Is to show support to a lot of these causes, but also from a dad's perspective on how we can help dads play a bigger role, right? And it's been well received, but it's about action. The Dads Caucus has taken positions on a tax package because we know that it was going to enhance the child tax credit, and it was going to help lift 16 million children out of poverty. That is huge. And then at the same time, we've heard of the concept of default parenting, right? That the mother is the one that takes care of the child, the mother that goes to the doctor's appointments, the mother is the one who's fixing the lunch. Well, there's also a concept, what I say is a concept of default legislating. Oh, that's a mother's issue. That is a black person issue. That's a Latino issue. And they can take care of it, but there's a variety of reasons. One, we do believe the people that are closest to the pain should be closest to making the decisions, but at the same time, we need to make sure that we create a space that dads and other individuals can get involved, because this game is about coalitions and organizing and numbers. And that's what the Dads Caucus is about helping sometimes stand shoulder to shoulder, sometimes behind, and sometimes in the lead when it comes to issues that deal with mothers, children, fathers, and the family. So, and that's what we're going to do. So, thank you, Charles, for everything that you've done, because that voice, when it comes to that space of maternal health, is critical. Because people often think, you know, it's only because you don't have access to health, you're not educated, blah, 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 right? All that BS. And then, you know, we know the statistics. We know the statistics when it comes to maternal health and the health of families. So I want to just say thank all of you for just doing what you do. Keep up the good fight, and next year we're going to do even more. So thank you, Lauren.
So as Charles mentioned, we brought you here to do some work, which means we're actually going to open with a discussion, and we want this to be interactive. I will start with the first question, and then from there, please raise your hand. I'll help moderate so we get questions. You can come up to the podium if you like, or you can call from your seats, but we do want this to be an interactive discussions with our guest panelists today. So, Congresswoman Underwood and Gomez, what do you see as the biggest opposition that is facing maternal health legislation in the House today? And what can we as constituents do to help you with that?
So we've been really, thank you for the question. We've been so successful in elevating awareness about the problem that there's sort of two phenomena that are happening. One is some of our colleagues who are less enthusiastic about embracing a solution that includes the word Black in the title are introducing watered down study bills to only solve a small portion of the crisis that would really only benefit their communities or states. Instead of having a wide lens approach that says, let's just end preventable maternal death once and for all. And so one of the challenges that we see is there is without a doubt bipartisan acknowledgement and recognition of the scope of the problem, bipartisan recognition that it indeed is a crisis, bipartisan recognition that we do need to increase the level of federal funding and resources, but folks who are eager to claim credit and to play some of the turf wars and who are wanting to kind of take a incremental, fractured, very, very, very small approach. And so that's one challenge that we face. We have to remain focused and united in advancing a comprehensive solution that helps all moms. Every definition within the Momnibus is expansive. It might be called Black Maternal Health Momnibus Act to acknowledge the pain and impact in our Black community. However, the bill helps moms in every zip code, in every county, in every state in this country. So that's one issue. I think the second is just that. It's called Black. And particularly as we look at the United States Senate, we understand that that has inadvertently created what they perceive as a permission structure to ignore the bill while their states continue to see dramatic increases in maternal deaths, particularly post-ops, right? Because the same map of states that have advanced partial or total abortion bans are the same states that have not extended Medicaid, are the same states that are seeing increased maternal mortality rates. And so from my perspective, we might need to make an adjustment next Congress. And I'm just telling y'all now so that, we're all on the same page when that happens. And so y'all know why we might be making those adjustments. Thank you.
No, it's, here it's definitely, I always tell people, first you have to agree that there's a problem. And oftentimes in this place, sometimes people don't agree. Right? Well, a good example, we can talk about climate change, and what's climate change, right? So when you can't even agree that there's a problem, it's hard to find a solution. And there is agreement, but I still think that there's a lack of urgency and understanding that this is a shame, right? The United States of America shouldn't have one of the highest maternal mortalities around the globe. It's just it's mind-boggling, especially from a nation that is affluent as the United States. Two, a lot of it does go back to some of these states having where you have the highest. It almost matches up, except New Jersey. So I'm glad that that Josh was here, it's all the states that haven't expanded Medicare, right? You know, they're against, and maybe they have a different view of what the role of government should be, but we have to make sure that we kind of change that idea. And then not let them get away with bills that are watered down or half measures that don't really do anything. Because a lot of people in this, and I guess in any aspect of life, but especially in Congress, love to act like they passed something but it has very little impact. So we're gonna have to make it a priority and just kind of keep pushing. But that's why developing these coalitions is big, because in the end it's about numbers. Josh might I point at Josh because he is kind of considered more of a business Democrat, right? I would say, which is fine. I'm a progressive Democrat. He's more of a business Democrat. But when they're starting to show up and talk about these issues, then it means that this issue is permeating within the greater caucus, and that it will rise up to a level of priority for the entire caucus. Because there comes a time where you're fighting for the big bills, and you're in a room. There is a room where it happens, and you want to make sure that your issue isn't cut and ends up on the cutting room floor. If not, then you have to go back again. So I think we're making progress thanks to Lauren Underwood and Alma Adams and a bunch of community, but we're going to have to keep at it because next year it's going to be a big fight. There's going to be big issues, but if we do it right, we're going to be able to make sure that this gets the money it needs to actually have a real impact. And it already is, but even more so.
So yeah, we can open up for questions. Do you want to?
Hi, my name is Jessie. I'm known as Coach Jessie. I'm a health activist. And my question, I totally understand what you're saying in terms of Black being a divider that really could stand in the way of it happening, and being smart about what it may require in order for us to progress. What are your concerns, and what kind of things can we put in place to make sure that if we do make that adjustment, that the impact won't be diluted, where the resources are diverted from us and where it's most needed?
Thanks for the question. What I'm talking about is just the way we speak about things. So when I speak about our work with the Momnibus, we just call it the Momnibus. In press, we call it the Momnibus, right? Hashtag Momnibus. Momnibus is what it is. The definitions are what they are. But I think the way that we speak about the work, we can make adjustments to be to extend a hand to folks who might be scared to reach out, but would be happy to accept that invitation. And that's the way that we're going to continue to expand this coalition, particularly among senators, to be able to get this signed as well.
Good morning. My name is Malika, as in I like the Malika, and I am the COO of the National Alliance Against Strategies in Patient Health. And I really appreciate you all having this breakfast this morning. We have a core concern for maternal and infant mortality, and so my question is: we have been doing monthly community town halls, which have been fantastic. Congresswoman Alma Adams' staff has come on town halls. They do legislative updates. We let the communities know. People just don't know what to do in order to participate. So in terms of mobilization, what might you recommend? For example, we tell them, hey, put in your zip code so you know who your representative is so we can advocate for you. Well, we did a little exercise and the zip codes were off. So depending on where you are, you don't know who your representative is. And we didn't know that. It was great that we did that on that town hall because now we know where we need to go to fight. But my question is, how do you mobilize when there's so many different things pulling people in the community away from the legislative process? Thank you.
Charles, you know how to do this.
I know how to do this.
Master advocate right here.
Oh, I mean, so I think that, so here's my question. What tool were you all using for the zip code?
We started with the one that's on the legislative site.
Okay.
So we sent everybody there, and then we asked them to put their, so just for full disclosure, when they
Sure.
register for our community town hall, we don't ask them for much information, but just their name,
Okay.
email, and zip code, and then we use that as an advocacy organization to then
Sure,
advocate on their
sure.
behalf.
Okay.
But when our researchers went in to try to find
The tool was,
Exactly.
I'd be curious about whose zip codes are coming up wrong. That's another thing. That's a whole, we may have to do some investigating in that. But so one of the things I can say is I think that, first of all, thank you for the work that you're doing. Thank you for raising awareness. Thank you for your efforts to mobilize. So first things first is we actually have a tool at 4Kira4Moms.com that will not only help you find your representative, but it will automatically 30 seconds. All you have to do is enter your first and last name and your zip code, and the site will automatically generate a letter that will go to your congressional rep, as well as both of your U.S. senators and the White House, respectfully demanding that they support the Momnibus bill. That's one. Two, so we'll make sure we share that with you. And I think the biggest thing, too, is that just having these conversations, and then also understanding that this is not just a federal issue. This issue is local. And it's important for all of us to hold, if we are going to give somebody the privilege of our vote, I don't care what party you're with, how you identify, where you live, it should be a requirement that the representatives, whether it's state, local, federal, that you are lending your vote to, have a plan for how they are going to improve maternal health outcomes and protect mothers and babies, right? And so we should challenge everyone. And it's just as important, if not more important, that we have these policies locally being reinforced.
Yeah, and so I actually teach a class on activism in Congress, and one of the at UCLA, and one of the things that I've always I witnessed. So it's not only about getting them the right information, individuals, but also the right strategies. You know, if we give people the wrong strategy, like, hey, we want you to ask for this, right? And that is never going to happen. Then people lose confidence
It's a great point.
that we can succeed. So it's often working with the legislators, like Lauren and other people that are in the fight here, to help kind of give you extra direction. Oh, we want people to co-sponsor. Well, what happens if one of your members is not? Oh, I don't know if I want to co-sponsor just yet. Okay, can you sign a letter to the appropriator? Right. Can you? Oh, you don't want to sign a group letter? Why don't you send your own? We don't Here's the So it's giving them different options that will still help, one, move the ball forward, two, get them more vested in the issue. Because once you get them on to send their own letter, to make a phone call, then you can come back and go, you built that first step of a relationship. So I've just seen folks that where it often fails is people have the wrong goal and strategy. Lauren was great, right? When she's been advocating for the Momnibus bill, but now it's trying to get it bigger and making sure that it has broader base of support, where the goals are the same, but the strategy is just a little bit different. So, but yeah, really kind of working with the legislators, and that's what I do. It's if I can't, there's some issue that I do, or a bill that I don't necessarily completely support, I said, but I agree with the problem. I'll write my own letter to an agency. I'll write my own letter to the appropriations chair, because I think more members are like that. You want to give them options to be successful.
Thank you for that.
Yeah.
And just also, we have 3 levels: awareness, advocacy, and action. Because as you said, everybody can't play in the same spot, but everybody can do something. So we try to make sure that whatever you're comfortable doing, we don't take everybody.
Exactly.
Thank you.
Yeah.
I just,
Okay.
can I add a couple things? So with the Black Maternal Health Caucus, we encourage people to share their own maternal health stories as they're having conversations with policymakers. A lot of folks don't understand how this crisis manifests as dual, both maternal death and severe complications. We call it mortality and severe morbidity. For every death, we see 70 near misses, and so that's why it ends up being something, at least in the Black community, that's so pervasive, because it's touched so many of us, but a lot of our elected leaders just don't understand the way that it manifests in our community. So please don't hesitate to share your stories. That is so powerful. Number 2, with the Black Maternal Health Caucus, we have a monthly newsletter. We're not gonna spam you. It's not gonna be 3 times a day, like we do our Democratic text. It's not like that, okay? I understand. It's $5. No, none of that. What we're doing is we're sending out information, including the funding announcement. Okay, so can we just have a really direct conversation about this money? This money is there for us, but we can't give it to you. Y'all need to go get it. Okay? We can't give it to you. You have to apply. A lot of our folks have never applied for a federal grant. And so they might find out the day before the deadline, and you've missed the opportunity to do the technical assistance, to build those partnerships in your community, to submit a really robust application. When we miss those opportunities, it's another year or year and a half because of the dysfunction up here before that money comes around again. And so we want you to be well prepared to get this money now. And we're having those conversations now. So I invite you to sign up for that newsletter. Last thing, I think it's really important for us to work together, okay? Sometimes our most successful applications are in partnership. In the same way, if we're gonna be successful in getting these Republican senators, we found that CEO engagement is essential. So I know we have a lot of advocates here. Our Black Maternal Health Caucus stakeholder group has been, really led by a lot of powerful gov affairs and, lobbyists, female voices, female-led, and a lot of the DEI groups. But that's left out a lot of our executive voices. And when we think about who is effective in talking with the Republican senator, it's often that CEO. And so for those of you who are connected with these large companies, please engage your CEO over the next 2-3 months, okay? Because we need those conversations to be happening now. Thank you.
So Jonathan's got one question, and I think that might be the last question before remarks. I think you guys are now.
First thing, thank you all for your leadership and Representative Underwood, all the work you've done. Charles, obviously bringing all this together in your advocacy for years, and Representative Gomez with the work around Dad's Caucus and bringing us all together here today. Jonathan Webb, the CEO for A1, the Association of Women's Health Obstetric and Neonatal Nurses. I had 2 questions, one for Representative Underwood and one for Representative Gomez. And you started to touch on it a little bit, I think, in your last response. With the projected strategy or intended strategy for not the name change, but the way we're messaging and talking about the work that we're doing in the Momnibus, is there a part of the strategy or thinking that there's an opportunity to engage some of those folks in states, Republicans in states who may not be supportive of this, to actually be involved in front and not just supporting it from behind the scenes? Is there a way to get them as co-supporters, co-sponsors, co-allies, allies? I don't know if that's a realistic expectation or not, but is the thinking that is there a part of the strategy that messaging may allow them to get out in front in that way? And then also for you, Representative Gomez, with the Dad's Caucus, have there been conversations about ways dads might be able to, dads and leadership may be able to bring some of those state leaders into the fold as well?
With respect to the creating space for Republican leadership, we need them to co-sponsor. So we are looking for a co-sponsor, a Senate Republican co-sponsor on the Momnibus. That is essential. We are not going to be able to pass the Momnibus without it. We came very close, my friends. We were right there at the finish line. And because we did not have one state Republican to put their name on the bill, we were not able to get the $1.2 billion to save mom's lives and end this crisis, okay? We need one. We don't need 10. We don't need all of them. We need one. We need your help to get that one. There's a lot of people who are, you know how in other healthcare circles we talk about curious and questioning? Y'all know what I'm talking about, okay. We have a number of our Senate Republican colleagues who what I would call curious and questioning, okay. I'm a nurse, so sometimes we come out with clinical terms, okay. So we would like for you, from states, well, Georgia, you got 2 great Democratic senators. But only one. Okay, all right. We know what's going on there. We know what's going on there. Okay. They're not both on the Momnibus. Okay, but
I'm working on it.
Yes.
By next week, we'll have it done.
But for those of you who live in those states, please reach out to your Republican senator. Please reach out. Your CEOs can reach out to that Republican senator. Everybody's gonna be home in October. Everybody will be home in October doing community events. That's a great time to go in and meet with your senator and talk with them about the Momnibus, co-sponsoring the Momnibus. I don't know how to be more clear than that. Somebody needs to put their name on it. if there's a reporter in the room, let me be more eloquent when you put the quote. You can find us afterwards, but this is just a straightforward conversation here. Okay, thank you.
Yeah. No, it's, I definitely, if you're looking for, what I try to do is figure out who's more likely to support something. So when it comes to, a good example, when it comes to the Dads Caucus, in order to be a member of the Dads Caucus, you have to support a national paid family leave program, affordable child care, and then the enhanced child tax credit that we passed. And if you don't support it, you can't join, right? It just kind of, I set a high bar because there are a lot of people that like to have the credibility of an organization or an issue without really putting any of their capital at risk. When it comes to like finding a senator, sometimes you have to figure out is there a senator that is more likely to get on board because they have an election coming up in 2 years? Or are they more likely to be on board because they just won re-election, right? You have to figure out which one is which. But then getting them to do the small things, I'm telling you, is getting them to just do one thing, you increase your chances of them doing another thing. And so I would kind of think about that. And you mentioned, what was the question again?
Around whether or not the Dads Caucus is focused on strategy to get some of these statements. Right?
Oh, yeah. So one of the things that we're doing is what I like to see, and somebody from, I think it was Georgia, a state legislator in Georgia reached out. He took his kid to the floor, to work. I want to see Dads Caucuses emerge in state legislatures around the country, where we can give them just some of the basic materials and they can do it on their own, and then we can, in that way, that we can have more people involved. So that's kind of one strategy I've been thinking about. Of course, I have get started in California. That's kind of easy. There's like 70% of them are Democrats, so it's a little easier. But in other states, it could be a little tougher. But I would love to see Dads Caucuses emerge in different states where we need that senator, where we need a little bit more support. And I don't know what it is, but for some reason, some members, especially the male ones, feel a little bit more comfortable, right? Maybe because it's like, if you're a dad, you're like, there's no stupid questions yet. I took my kid to, the playground. I didn't have a snack for him, right? Like dads do that shit all the time. Go back and I don't know what it is, but
It's real.
I remember leaving my wife, mothers are great. They like pack a whole go bag. It's like getting ready to go on like a month-long trek through the Himalayas or something.
Yep.
Dads are like, give me a diaper and applesauce and some crackers, and I'm ready to go to the park. So I think it's kind of getting them involved. But the dads, what's great is that we encourage dads in the Dads Caucus to do events in their districts. They do child care visits, child care center visits, and those are really popular. They go and do paid family leave visits, and even with the Dads for Kamala, we're going to start doing some going to football games during the fall as dads to talk about why Kamala is the best for working parents. Even though I'm probably not supposed to talk about that here, but there's a lot of things we can do. But the dads, it's interesting. Rashida Tlaib, she started the Mama's Caucus. I joined it. She joined the Dads Caucus. And she basically, the New York Times called her and said, what do you feel if the Dads Caucus is getting all this attention? She said, I don't give a shit if they're getting a lot of attention, as long as it's getting attention on the issues that I care about. So it's still kind of brand new, so if we get more dads involved, maybe we can get some of these people who are a little bit hesitant to join the cause to join.
Awesome. So I'm gonna bring us in for a landing and close out, because I know that both of our congressmen and congresswomen are very busy. But let me say this, I'm going to just piggyback off of what Representative Gomez said, and just share a little bit. I'm going to say some of the stuff that they can't say, right? From a strategy standpoint, one of the things that has been effective, even when we were working on the Preventing Maternal Deaths Act back in 2017, when we were working to get bipartisan support, is this idea and this notion. Y'all remember the movie Inception? Basically, like, where you plant an idea and you make them think it's theirs. And so what I would do when I would go into offices that were a little bit stubborn, I'm not going to talk about what party they're associated with, but a little bit stubborn, is I would present this as an opportunity. Senator, wouldn't it be great for you to get behind something that is uniquely bipartisan in a time that's so divisive? Wouldn't it be great for you to show your constituents that you're taking a strong, definitive stance for mothers and babies, and to be the first? And they start picturing themselves, right? And you tap into the things that make sense for them, right? And you present this as an opportunity. So that's one of the things that I would challenge you to use that strategy. Beyond that, I want to talk about what we're doing, and I want to talk about something that Representative Gomez inspired. So I've made probably 30 plus trips to DC in support of various legislations over the past 8 years. And one of the things after meeting with you when I was here last year is I realized that with all the groups and all the amazing coalitions that we had brought to Capitol Hill, we had not done a coalition of fathers. And so we will be here next Tuesday with just that. A group of fathers from all over the country. Jonathan's going to be here with me. And we are going to go. We're going to have a congressional briefing Tuesday morning, and then that afternoon we are going to go forward and have a series of office visits with one clear objective, and that clear objective is to get a Republican sponsor in the Senate for the Momnibus, right? And so when we talk about this intersectionality, and particularly as Black men, we oftentimes don't think of ourselves as privileged. But as Jimmy was saying, as Representative Gomez was saying, we have to understand that as men, there's a certain level of relatability, and we have to leverage that to its fullest hilt. And so we are going to go in and we are going to respectfully demand, we're not asking, we are respectfully demanding that one, if not multiple, Republican senators show up and sponsor this legislation and do it now. So with that being said, I want to thank all of you all for coming. Thank you for being here. Thank you for your contributions. We'll be hanging out for a little while, but please make sure before you leave this room that you connect with somebody, because this room, I'm looking around and I'm so extremely happy because we have some dynamic people with very, very, very unique skill sets and resources that are all here collectively fighting this. So make sure you connect with somebody. Thank you all so much for making this a very special meeting.
Thank you, Tom.
Thank you. Of course, you kidding me?
I'll see you later on.
I know.